Hello, everyone. Greetings from Virginia and Connecticut. Today, we are lucky to have Dr. Sadiq Naveed, who is the Psychiatry Adult Residency Program Director at Eastern Connecticut Health Network. This would be his first season as a program director, and he's currently interviewing for both PGY1 and PGY2 spots. Today, our topic of discussion is how can a foreign medical graduate do a fellowship or further specialization training in USA without actually doing a residency? Because usually the flow goes like that. First, you have to take all your USML exam, ECFMG certified. Then you apply to match. You match at a residency program. You finish residency, and then you are eligible for fellowship. But there are some circumstances in which people who are at least ECFMG certified, they are able to opt for those fellowship spots. And Dr. Sadiq Naveed has a fair amount of experience in that. So that's why we are making this video, because lately a lot of people have been asking us. So without further ado, Dr. Sadiq Naveed, please, thanks a lot for joining us. I know it's a Saturday evening and you were on call. Thank you.
No, absolutely, Dr. Ahmad Khan. It's my pleasure. And it's really nice to be here. I think there is a chance for IMGs here. So I just wanted to highlight and just it is not for IMGs, but because IMGs go through that route. So we just wanted to speak about that, and just the fellowship match for medicine just announced their results, and also psychiatry is also going to announce their fellowship match results sometime in first week of January. I'm not aware of the date. I think, like we were discussing, we can first talk about, what's the requirement, and then we can talk about the criteria, and then we can talk about the scope of practice. So as far as, ACGME requirement is concerned, ACGME says that if someone is exceptionally qualified, they can go to an advanced level position. They'd leave it at pretty much. Now, the definition of exceptionally qualified, that is left to a local GME, and they decide what's the definition of local, exceptionally qualified, and it can vary from program to program and institution to institution. And, by the way, local GME that I refer to, GME means Graduate Medical Education Committee. At each institution is required to have a Graduate Medical Education Committee. In other words, it's a mini version of ACGME that look at the educational and regulatory compliance at the institution level. So that's the rationale that is used to induct people into these advanced level positions. Now, what's the criteria? And this goes for all specialties. And, again, I just want to do a note that it can vary from a program to program. So one question that you also come across is whether people can get into fellowship without doing USMLEs. So ECFMG certification is certainly required, because ECFMG certification, as you know, is a licensing requirement that's required by all the boards, licensing boards in the United States. So you need to have ECFMG certification. The second thing that comes is USMLE Step 3. Almost all the programs that I know of, they require USMLE Step 3. However, I know of some candidates in rare circumstances, they went into a fellowship without doing USMLE Step 3. That's the second criteria. So first is ECFMG certification. That's absolute must. Second is Step 3, almost required most of the time. Now, third thing is home country residency. As far as I know, just taking an example of Pakistan, FCPS is a postgraduate diploma, which may not be required, but you need to have completed your residency. So it's not the degree, it's the completion of your residency that matters. So if you have completed that, 3-4 years of psychiatry training, how long it is in your home country, if you have completed that, then there are some programs who may take you into fellowship considerations. So home country residency is one. Second is also people who have done 1 year of ACGME accredited residency, they can also go into fellowship match. So I know few candidates who have done transitional year and then they got into child and adolescent psychiatry, and they can go into the other subspecialties too. Now, one question that someone can ask is, uh, there are some candidates who have not done a home country residency and who have not done 1 year of ACGME accredited residency, but they still were inducted into fellowship mat, but they have a lot of research experience. So I think those are rare circumstances. I just know of one candidate who got inducted that way. So just remember, if you have home country residency, if you have done 1 year of ACGME accredited residency, then you should apply or you try your luck getting into fellowship match. Then another thing that comes across is ACGME I accredited, which is ACGME international accredited. Now, some programs says because those program meets the ACGME standards, so we're gonna take those people into fellowship because their training from their back home is ACGME accredited. So, for example, in Pakistan, Aga Khan has training program. There some of the training program, for example, in psychiatry, that is ACGME I accredited, but that is not equivalent to ACGME residency. So they cannot come here under that residency and get the license and start working. They still got to do their training. So just to wrap it up, you need ECFMG certification. In almost all cases, you need USML step 3. Third thing is you would certainly need your home country residency experience, or you would need 1 year of ACGME accredited residency. So in very rare circumstances, you can get into fellowship match if you have exceptional experience. So
I think the last point is the scope. Once someone does it, direct fellowship with ECFMG certification step 3 without residency, where would that person stand?
Yeah, so I think, most people I know of, and that's my recommendation would be, if you're planning to stay here in US and want to practice here, go do residency, because that will allow you and open your scope of practice, right? Let's say you did, and my experience is mostly about psychiatry, so I'm going to give examples of psychiatry. So you came here, you did 2 years of child and adolescent fellowship. And I have come across one of the candidates who just came here for fellowship, and they want to go back to their home country to practice child and adolescent there, which is perfectly fine. In that case, I think that's okay. You don't need to do residency. Come here, do fellowship, and go back home and serve patient population there. But if you want to practice here, then it's I think beneficial to do residency. And just because you're in the system, people, you start building networks, and you start building connections, and people can see your work ethic. So that will help you a lot to get into residency. And that will also give you an opportunity to go to full license. Now, I know that different states have different requirements when it comes to full license. So some would say you can get full license after 1 year of training. Some would say you can get full license after 2 years of training. So in those cases, if let's say if you've done 2 years of child and adolescent fellowship, and because for most states, they will let you have full license after 2 years of training. So you can just practice, but your scope of practice is limited, but because you can go to only certain institutions, your area might be limited. So I would always suggest people, if they can get into residency experience, please get into residency experience.
Yeah, and I'll give some examples. So for medicine, there were a friend of mine actually from my med school. So what he did was that he was ECFMG certified. He had even taken step three. He applied. He did not get matched. Then what he did was he went back to Pakistan. He started his training. Then he actually cleared all the MRCP Royal College of Physician membership exams and went to UK. Was practicing. On that basis, he actually applied for nephrology fellowship. He got it. He did that. Now after doing that fellowship, now he's doing residency, which he wanted to do, but he was given an opportunity where he could actually work as a nephrologist, but only at that specific hospital. And the compensation, the salary which they were offering, that was almost half of what they would offer to another nephrologist. So yes, I totally agree that if you want to do practice here, the best thing would be to get into residency. You can still practice, scope would be limited, you would be not paid as much. So there are few fellowships for internal medicine which I have seen over the years that there are a lot of spots left. One would be geriatric medicine fellowship, palliative care fellowship, in some cases even addiction medicine fellowship. Nephrology is one of them. In some cases, even to some extent, I would say endocrinology, but usually it's not the case. Now, these are the accredited ACGME fellowships, and then there are some unaccredited fellowships. I know some people. One of the person I know did like a neuro oncology fellowship here. So those are the things which people also do. In psychiatry, almost all fellowships would have spots left because in psychiatry, if you do 4 year of training, a lot of 90% of the people would not go for fellowship. So child adolescent, forensic, geriatric, even CL, you name it, and they would have spots. Even some non-ACGME accredited fellowship like interventional psychiatry, neurobehavior. So there are a lot of opportunities for IMGs.
Yeah.
So any concluding remarks, Dr. Naveed?
Yeah, no, so I think you pretty much summed it up. And one best thing to reach out to how to connect with them with those programs. There are no lists. So each year when they go through the match, and if you know of the unfilled positions, you reach out to the programs directly and you explore their criteria and ask them, hey, this is my resume. Would you be willing to consider me for your fellowship positions? And you and I both know people who have matched into child and adolescent addiction medicine. I know someone in forensics. I know, geriatrics. I know people who have matched into nephrology this year, infectious diseases. So it's very possible, but you have to reach out to those programs individually, and there is no way around that. I also want to highlight something, it's skipping my mind. Hopefully it will come back to me. You mentioned about non-ACGME accredited residency. So, for example, Binghamton General Hospital does neurocritical 1 year experience, and that's a non-accredited ACGME residency. If you have a choice and you don't have any other choices, I will say go for it because you are getting hands-on experience, is you're getting paid, and then third thing is an institution like Binghamton has internal medicine residency. They also have psychiatry residency. They have other residency program. So they are seeing your work ethics, and then that's what leads you into securing a spot in future.
Absolutely. Okay, all right. Well, thanks a lot, Dr. Naveed, for your time. I think this video will be very helpful for all the foreign medical graduates or international medical graduates, what we call them. Best of luck, everyone. Thank you.